First, we clean the underarm area thoroughly with an antiseptic wipe. Then we mark where the sweat glands are located prior to using the local anaesthetic to numb the area. This part of the procedure must be performed by a nurse practitioner. We inject a large volume local anaesthetic because it quickly numbs a larger area. It also slightly puffs up the skin, so you get a better contact area when we start the Miradry procedure. The local anaesthetic works very quickly, so it's only the first one in each side that might be a little uncomfortable. It looks worse than it is, but it actually uses very fine needles. We use about 3 to 6 syringes per area depending on the size of the underarm. Then we apply the Miradry grid template. This leaves a temporary grid pattern on the surface of the skin, so the practitioner can map where the procedure is going to be performed. This provides an accurate guide to the placement of the Miradry handpiece. Miradry uses microwave thermal energy to destroy the sweat glands. It targets both the apocrine and eccrine glands. The apocrine are the glands that produce sweat with odour and sit alongside the hair follicles. The eccrine glands are the glands that produce the moisture on the skin. Energy is delivered through the handpiece deep into the dermis, where the sweat glands are located. You may feel a bit of suction when the device is placed on the underarm area. You may also feel a bit of heat, but the procedure should be pain-free. If you ever feel uncomfortable though, we can move the handpiece to the next position. The number of procedures a patient needs depends on the individual, but typically only 1 or 2 are required. We advise waiting 3 months between sessions to be able to assess the amount of sweating reduction that has been achieved. The longest part of the procedure is often the local anaesthetic, and the actual Miradry process is very quick. Immediately afterwards, ice packs are applied to reduce heat, swelling and bruising. The local anaesthetic should last about 2 hours afterwards. You can continue to apply ice packs regularly for 48 hours, and we advise taking paracetamol or ibuprofen when you return home. You will also be given some antibiotic cream to apply to the underarm area. Shower as normal, but be gentle and pat dry the underarm area, as it will feel numb for some time after. We advise you do not shave until sensation has returned. You can expect an 82% reduction in sweating. Odour is also reduced, and another benefit is that the hair follicles are destroyed, meaning you get permanent hair reduction at the same time.